we wanted to look at differences in the stage at diagnosis between younger and older lung cancer patients, and median and survival between younger and older lung cancer patients, and specifically look at how the stage at diagnosis and survival has changed over the last decade, particularly with the onset of lung cancer screening in the US in December 2013. And so we used the National Cancer Database, which is a big, one of our big cancer registries in the US that covers about 65% of all lung cancer cases diagnosed in the US each year, and the United States Cancer Statistics Dataset, which is a population-based registry which captures about 99% of all lung cancer cases in the year, diagnosed in a year. And what we looked at was, one, are younger patients more likely to be diagnosed with later stages of lung cancer? Two, how has that changed over time from 2010 to 2018? Three, what's the survival rate of patients diagnosed with lung cancer, and how does that differ between younger and older patients? And then four, how has median survival over the last decade changed among younger and older patients, particularly with the NCCN's recommendation for genetic testing for EGFR and ALK mutations and the approval of immunotherapies in 2015. And so what we found is that there is a huge difference in the stage of lung cancer diagnosis between young and older patients, with younger people being much more likely to be diagnosed with late-stage disease. Among our patients aged 20 to 29 in our cohort, 76% of patients were diagnosed with stage 4 lung cancer, compared to only 40% of patients aged 70 to 79. And so you can see that with increasing age, the percentage of patients diagnosed with stage 4 lung cancer decreases, and it's extremely high among your younger ages, aged less than 50. The next thing we looked at was, over time, has there been a shift to earlier stages of lung cancer identified? And so we looked at, within each age group, in 2010 versus 2018, was there a decrease in the percentage of lung cancers diagnosed at stage 4? And what we found was that among our 20 to 29-year-olds, 30 to 39-year-olds, and 40 to 49-year-olds, there was not a decrease in the percentage of stage 4 disease diagnosed. So most patients continue to be diagnosed with stage 4 lung cancer, whereas in your older age groups, your age 50 to 59, 60 to 69, and 70 to 79, there was a significant decrease in the proportion of lung cancers diagnosed at stage 4. And it's likely due to a number of factors why you see a decrease in the percentage of stage 4 among your older patients, but one of them is likely the onset of lung cancer screening during the time period. So I think that we need to focus on how can we better identify young individuals at high risk for lung cancer, because right now in the United States, under the most recent guidelines, lung cancer screening is recommended for people aged 50 to 80 who have a 20-pack year smoking history or greater and have quit smoking, or who either currently smoke or have quit smoking within the past 15 years. But what we now understand is that lung cancer diagnosed among younger people is quite different compared to lung cancer diagnosed among older people. And so we really need to focus on figuring out how can we identify those people at high risk for lung cancer, so that we can then offer them screening. And so there's a number of things like risk prediction models, identifying biomarkers that we can use to better select these individuals. But I think it's a really complicated problem, and it's something that really we need to focus more on. And the thing we were excited about our study was that it's not a problem that a lot of people are aware of. And so when people think of lung cancer, they often think of older individuals diagnosed with lung cancer. And so it's important to know that there is this subset of patients who are diagnosed with lung cancer and currently are diagnosed at a very late stage. And although being young, they have poor overall survival. And so we do need research to better understand how we can improve early detection among this cohort of patients.